Okay. So the situation right now in Switzerland and also in all most of the Western world is that we have a twisted triangle. So the patient or the insured, the population, has the insurer or the state, like in some country, the state is the insurer, that is interested with him as long as he's healthy and is paying a premium. And then you have the healthcare world, the doctors, hospital, the industry, which is interested in the person as soon as he becomes a patient. And so for an insurer, an ideal patient is a dead patient, because so you can make the final accounting of the case. And for the healthcare world, an ideal patient is a chronic patient, and there is no interest in really cure the patient, because if the patients come back, then you can bill again. And so this problem is really this fee for service system that gives to every player the wrong incentive. The Swiss healthcare bureau, the Federal Office of Public Health, has a vision for integrated care that was the Vision 2020, which is not achieved because we're almost at the end of the year, and it's still not the case. But the slide that I took on the website of the FOPH is completely right, and I think everything on the slide is right, and plus you see that it makes the Swiss cross in the center, so it's beautiful to show to the attendants. What are we looking for? We are looking for an integrated care system to follow up the life of members during the whole life, from birth to death. We're not going to integrate the funeral houses, but the whole chain of value, apart the funeral house. And integrated care system must bring together all the players which have currently divergent interests. In the healthcare environment, you have players in wellness, nutrition, checkup, better aging, basic care, telemedicine, etc. And each of these silo is working for itself and has a different margin. Some have a high margin, like the hospital, and some have very low margin, like home care services or rehabilitation. And so everybody wants to invest in hospital and in activity where the margins are higher, and the rest has to be subsidized by the state. So once again, we have to bundle together all these activity to be able to make a cross financing and to have everybody in the same boat. And the goal is, of course, to transform a system of which some take advantage into a system that advantages everyone. And how can we do that? Keeping citizens healthy, improving the patient outcome, and bringing together insurance and care providers. So, I mean, we have to transform it into a health organization which provide both insurance and care to have the interest completely aligned. And of course the example is Kaiser Permanente, which is a virtuous triangle. You have the member paying to subscribing to a health plan. Health plan is paying full capitation amount to both hospital and doctors. Doctors stay independent. They have their own decision process. in the permanent medical group. And I think the three organizations bundled into Kaiser are providing to each of the Kaiser region the better services. And we see now, for instance, during the COVID, in Switzerland, you have the insurance, there are plenty of money because of lack of surgery. They have not reimbursed surgery, non-urgent surgery, so they have maybe 3 to 4 billion Swiss francs. And hospital which have not performed any surgery have rentability problem and solvency problem. In the Kaiser organization, so the money stays in the organization, and Kaiser can use this money to inform its member, to subsidize a clinical study for the vaccine, etc. And we can look at the number. They have 12.2 million members. We have 8.4 million people in Switzerland. They have 22,000 physicians. We have 37,000 physicians. And they have 39 hospitals, and we have 281 hospitals in Switzerland. So some key number that talk for themselves, and no need of big explanation where the problem is. Integrated care requires digitalization, but also brings digitalization, because in an integrated care organization, everybody has an interest to share the information, which is not the case now, because if a doctor has to reassess a patient, he can bill again this assessment. So he has no interest to share the information of with another doctor. So the integrated care are also an motivation to accelerate the digitalization in healthcare. There is in Switzerland plenty of potential stakeholders for such organization. Of course, you have the world companies like Roche, Novartis, Zimmer, Johnson & Johnson. You have the hospital organization, some university hospitalization, so university hospital like USZ, Inselspital. You have some network like Swiss Medical Network or Islanen, and also a lot of other regional players. We have insurer, we have healthcare insurer, we have non-healthcare insurer. Maybe some non-healthcare insurer would have an interest to enter this market with an innovative product. We also have what we call maybe system relevant companies in Switzerland. So big company like Swisscom, Credit Suisse, UBS, SBB, they all have a lot of clients, so they have distribution possibilities, and they could have an interest in participating in such organization. There is a lot also of service provider in healthcare, like all the Spitex, Medgate, Medi24, the Touring Club Suisse, the Rega, and some retailer that are also looking at healthcare, like Migros. I think the most advanced in this field is Migros now with Medbase. But of course, other retailer could be also interested in providing healthcare services to their clients. So putting together a few of these players could give birth to a Swiss accountable care organization. So to avoid conflicting interest that don't benefit patients, so health conflicting interest between insurer, healthcare provider, industry, and politics. Politics is, I think, one of the most conflicted player in healthcare because they have to be re-elected. We see now the difference when the crisis management was held by the federal government during the acute phase of COVID 19. The federal government is not elected directly, so they were not running a campaign. But now that the cantons have taken over, you can see Mr. Poggia and all these healthcare minister working for their re-election and taking a stupid decision. So bringing these actors together means that we have to align interests and prioritize the preservation of health and develop coaching and support measure proactivity. And Swiss Medical Network is largely involved, actively involved in building such organization because we don't want to be the Kodak of 2030, and we want to be there after COVID and for long year after all those change. And we are working for an efficient health system that put the citizen at the center. And we are convinced that this system has to be independent from the state, even if the state can be a stakeholder. I mean, in the Swiss banking system, there is a lot of state bank, but they are independent. They have their own governance, and they can compete with other full private banks, and could be the same in healthcare. So one mission, one vision, and one team to have one organization. That's our vision for the total health in Switzerland. COVID-19, what did we learn? So the Swiss healthcare system has generally held up very well. There were a sacred unity of physicians and caregivers. We have very well trained, equipped, and well paid medical staff and modern infrastructure. So that was a good asset for Switzerland. The federal emergency law and cantonal autonomy was a good mix, and I mean, at least it worked. It was a little complicated, but since we are also regionally organized, we have been able to be part of this COVID response system in all the cantons. It will trigger a consolidation of hospital, clinic, and caregiver organization because I mean the weak will not survive to this crisis. Public-private partnership are essential. We have seen that during the COVID crisis. And I think it is the demonstration that we have the need for a shift toward an integrated care system in Switzerland. Thank you very much.